Malta's future starts with a conversation. Idea Talks.
Welcome to Idea Talks. In these interviews, we are bringing together leading voices from academia and the world of business to explore the insights, the innovations, and the real-world strategies that are shaping our future. For this episode, we have with us Dr. Yaser Teebi, who is a clinical psychologist working in geriatrics. Dr. Teebi, thank you for joining Idea Talks.
Thank you, Frank, for the invite.
Before we start, talk to us a bit about your background. You are Maltese, but your name doesn't sound typically Maltese. So
absolutely.
Where were you born? What's your background?
Absolutely. So I was born in Malta, but originally my parents and my grandparents and my family are from Palestine. They moved out in 1949 as they were displaced, and there were these issues going on. And my father originally then came to study medicine here in Malta in the 1980s, and he stayed here, and he's worked here for over 40 years now, and I was born here. So
your father is a medical doctor?
Exactly. He's a doctor, he's a consultant now, he works with the ministry as well. So he's a consultant doctor, but works with the ministry as well. So he's in medicine and healthcare.
So you have decided to follow in his footsteps?
More or less, yes. It was always a calling for me to be in healthcare, to be part of healthcare, to help people and to support people. And it's a big passion for me.
So it wasn't a coincidence that you are a clinical psychologist? It's
no.
Something that you, since from a young age, probably you were accustomed to at home, hearing all the time about medicine, the medical jargon, books related to medicine. So you grew up in that environment, right?
Absolutely, Frank. And also sometimes when my father took me also to work, a few days here and there throughout my childhood, in hospitals, in clinics. So it was always a passion for me. It was always either medicine or psychology. And I chose psychology because I felt with psychology I can be more at an emotional level with the people I work with. So
you are a clinical psychologist working in geriatrics, that is in the old people's,
exactly,
the elderly care. So what's a typical day in your life?
So a typical day, currently working at a hospital in Malta. Currently, it's going into work, seeing what patients and appointments I have for the day, liaising also with the nurses and the doctors of the wards, for example, and the different multidisciplinary teams, professionals. So with physiotherapists, occupational therapists, for example, liaising with them to working on a common goal for the patient and the client we work with. And that's basically a typical day. We end up seeing maybe 4 to 5 patients every day, 4 to 5 sessions. There's mostly a lot of research involved, reading involved about the case. So, for example, depression with someone who has cancer is different from depression with someone who has had a leg amputated. So reading and a lot of research is always involved in a typical day.
And your specialization, your PhD dissertation, was in dementia?
Yes, it was focused more on awareness in dementia, where I looked at and I investigated the levels of awareness of persons with dementia themselves about changes happening in the relationship. And the results were interesting, and they showed, important clinical aspects that can help clinicians working with persons with dementia and their couples.
The perception for a non-medical person like myself and for many others is that dementia is on the rise. Are we?
Yes.
Is that a correct? Is it just a perception, or is it's a fact?
It is on the rise, and especially because when you consider that the number of older adults is also on the rise, then it is reasonable to expect that conditions associated mostly with old age will also be on the rise. So it is a linear scale.
Is there a way how dementia can be avoided, or it's a natural progress?
In terms of avoiding dementia, it's very difficult to say. It's practically impossible to say, do this and you will definitely not get dementia. So there are multiple factors. There's genetics, there's the diet we have, there's pollution as well, there's stress-induced factors, for example, the amount of reading one does, the amount of exercise one does. So those are all factors. If you maintain these healthy habits, it is more likely than not that you won't get dementia, but it is impossible to say. There are people who have led active lifestyles, who have led very healthy ways of living and still suffer from dementia. So no, unfortunately, there's no one way to kind of prevent dementia from being diagnosed and happening.
What's one skill that nobody teaches you, but which every psychologist needs to have?
I think patience, Frank.
You have that?
I try to. We're all human. We're not infallible. We have moments where we are without patience and where we are impatient. But it's something that is not taught at university. We're taught to reflect. We're taught to be aware of our blind spots, make sure that we're always going to supervision. But being patient and dealing with, the same issues over and over again is something that is one skill that every psychologist needs.
In fact, which brings me to my next question, which is the hardest part of working with patients with dementia? Does it have an emotional toll on you?
Definitely, because when you look at older adults, what do you see? Sometimes you see yourself in them. You see yourself 20 years, 30 years, 50 years down the line. Will I be like this? Will my grandparents be like this? Will my family be like this? My father, my auntie, whoever, my sisters, my brothers. So yes, it does take an emotional toll. But this is one thing that we do learn. We do learn to kind of try and withdraw from these emotional entanglements.
What keeps you up at night?
A lot of things, Frank. A lot of things. I think knowing that there's a lot of evil and hatred in this world, and as a psychologist that wants to support people, knowing it's very difficult to reach everyone. That's something that keeps me up at night.
Is empathy something that you train to achieve, or is it something that you're born with?
I think a bit of both. Empathy is something that is a natural trait within you, but you learn to use it better. You learn to pick on things better. And so that emotional trait, that personality trait of empathy, you learn to utilize it better.
What do you consider to be the most underrated skills in geriatrics?
Again, so it's related to patience, and I think the general team will be about patience, but I think it's listening. Frank, we hear a lot of things, but are we truly listening to what is being said? Are we listening to what is being said between the lines? And I think that is one underrated skill in geriatrics.
So you're meeting people with a lot of conditions, old age in
Yes.
itself results in a lot of conditions, but you're dealing a lot with patients with dementia.
Yes.
Are you afraid that one day you might be one of those patients?
Definitely. Sometimes they say knowledge empowers you, but also knowledge can scare you. But hopefully with these advancements that are happening today, hopefully with the level of support that person with dementia can get today, then hopefully that fear will subside. But definitely, it's not something to be happy about when you hear there are health conditions that may happen.
On whom is the greatest emotional toll? Is it on the patient or is it on their relatives?
Research shows that it is heavier for caregivers, but now we're starting to understand as well that persons with dementia themselves also get an emotional toll.
So they are aware that they have the condition.
This is the issue. Some people will know that there's something wrong, but they will lack awareness that this is impacting them in this way, for example. Or they will lack awareness that they do need more help, that they do need more support to help them cope with these issues happening. So yes, definitely. I think it is an equal toll. But from the caregiver side, watching your loved one remain there, but emotionally disappear, personality-wise disappear, I think that's not an easy condition to
We
be.
hear a lot of heartbreaking stories because that's what they are ultimately, whereby you hear people tell you that you'll be speaking to someone whose mother has dementia and he'll tell you she doesn't recognize me.
Yes.
She asks who I am, or she asks about her husband who would have died years ago, and
Definitely.
she asks where she says that she wants to see him.
Absolutely. And it's kind of, what do you tell these people? How do you support them? How do you
What do you tell
let them down? You just listen to them. This is what I'm saying. You listen to them. You listen to their pain. They miss people. And so maybe you show them pictures, maybe you kind of try and divert their attention as well, but you stay with them. You don't break them down. So that's important. This is where empathy then comes in.
So, if I am understanding correctly, so let's say there is a situation whereby an elderly woman is asking for her husband who died 10 years ago. Do you, as a clinical psychologist, if she point blank tells you, please call my husband, do you tell her the truth that her husband had passed away? Or how do you deal with such a situation?
So it's no one size fits all approach, Frank. You have to see who the person is. Are they used to being told straight to their face what the issue is, what the problem is, or are they used to more of a softer way of approaching things? So this is very important. But yes, it's also important to be direct. Listen, for example, your husband is not with us anymore. Let's look at pictures. Let's remember how much he loved us or how much he cared for us. Absolutely. Being direct is also important.
There it is still, and for a second I will divert a bit from the geriatrics side of care.
Sure.
It is still a bit tabooish for a person to go to a psychologist. If you're going, and all of us go through difficulties in life, but if you're passing through a rough patch, it is still a bit tabooish to go and see a psychologist.
Yes.
Because, why?
Because there is a lot of stereotypical links that if you go to a psychologist, then you're weak, you're vulnerable, or you're crazy, or there's something major going on. And that's not what we want. Some people are genuinely just need a safe space to talk about things, a safe space to open up about their issues and their emotions. There's nothing wrong with that. And this is what we have to break. It's better nowadays, but there's still this stereotype, and we need to work harder to break it down. If a person is going through a tough time, there's absolutely nothing wrong with seeking support, and that does not mean that the person is vulnerable or weak or a failure or they've lost in life. Not at all. That's far from the truth.
We hear a lot about the word depression.
Yes.
And as serious as it could be, but it's branded about, people say that if you're feeling a bit down, automatically people say, I'm depressed. I have a mental breakdown or something. Are we I don't know, but are we making it sound so simple, this thing about depression? Is it always depression? That's my question. Or is it a rough patch, a moment of stress, and people decide that they have depression?
Absolutely. So clinically, the diagnostic criteria requires symptoms, requires to be around 5 or 6 symptoms to be present for at least 2 weeks continuously. So it's not just I woke up one day and I decided I have depression. There's diagnostic criteria. But yes, it doesn't mean that we can't go through tough phases, we can't go through low moods, every one of us has woken up one day not feeling like going to work or not feeling like facing the day. Doesn't mean we have depression. No, right? That doesn't mean we have depression. Depression is when we have significant impacts on our daily life, on our daily functioning of daily life, that is inhibiting our full potential. So then we lose hobbies, we self-neglect, and this is continuous for 2 weeks. So that's the difference.
You teach at Idea College as
Yes.
well. What modules do you teach?
So I teach on the MSc for Elderly Care Management. I teach psychology and psychiatry of old age. I'm also an examiner, dissertation examiner, dissertation supervisor, and I'm on the board of studies for bachelor's dissertations.
So a 21-year-old comes up to you and tells you, Dr. Teebi, I would like to pursue psychology as my professional field. What's your advice?
Go for it. My advice would be go for it, but understand that it takes a long time to achieve it, to arrive at the stage. So it takes around, if there are no hiccups, 9 years from the moment you get into your first
9 years.
degree.
That's a long journey.
That's a long journey to getting your warrant to practicing as a fully fledged psychologist. So be patient. Again, that is the theme. Be patient.
In moments of grief and loss, what matters more than just words?
Being listened to, being appreciated that you're in pain, that you're grieving the loss of something or someone you loved. It can be the loss of mobility, it can be the loss of a pet, it can be your family member, your best friend. but you're grieving. You can be even your job. A person can grieve their job. So appreciating that this, whatever the person is grieving, has meant so much to them. And understanding that, passing on this understanding and this feeling is very important to helping a person feel listened to, feel heard.
What impact is social media and the constant use of social media across all ages having on mental health?
I think we just had there was a public consultation recently about social media reform, and I was involved in it, and the message was clear that a lot of people are becoming very addicted to social media, and social media is impacting the way they see life. Because if you're on social media and you're driving a very luxurious car, then tendentially what happens? I want to be seen driving a very luxurious car, and I'd rather not eat, because that's not what appears socially, but I'd rather be driving a luxurious car so that I can get all this attention. So yes, social media can be a dangerous aspect, but the message was clear. Can we use social media to improve our mental health as an advantage rather than a disadvantage? So this is the way forward, understanding how best to utilize something that will never go away. Just a quick point, for example, if you look at AI and ChatGPT, stuff like that, these are things that will only improve across time. So it's not about banning them, it's about learning how to use them.
Okay, but you mentioned that you anticipated my next question, actually, because people nowadays, you often hear people say, I was feeling a bit down, I was feeling stressed, I had a problem that I wanted to resolve, and I went on ChatGPT and I asked ChatGPT to give me advice.
Very dangerous. Very dangerous, Frank, because ChatGPT is not structured, is not built to understand human emotions in a way that a psychologist does, to give empathy, to challenge in a way that is empathic. Big part of therapy is challenging, Frank, and challenging in a way that can help reflection. ChatGPT doesn't do it effectively.
One last question, in one sentence, if you can. What kind of psychologist, clinical psychologist in your case, do you hope that you will be remembered?
I hope to be remembered as someone that has touched people's lives, that has supported people, and that has impacted the person's way, even if it's just 0.1%, impacted the person's life in a way that has helped them feel supported. And that's what I want to be remembered as.
You're still young. How old are you?
31.
You're 31, so approximately have another good 32, 33 years till you retire.
Exactly.
Do you see yourself doing this for the rest of your life?
Coincidentally, if I may, if we have a few more seconds, I was now recently just appointed as Director for Community Wellbeing within the Ministry for Health and Active Aging. So now on a full-time basis, I won't be practicing as a clinical psychologist anymore, but I will be practicing more of a management and policy making to help increase initiatives for older adults. Privately, obviously, I'll still be able to work.
But will you miss the field?
Privately, I'll still be able to work as a psychologist, but yes, I'll miss this one-to-one aspect. But I hope that after 9 years of working in this field, I can grab the clinical experiences and use them to increase initiatives and increase protocols to help older adults in general. Now, it doesn't mean that this is the end of my road as a psychologist, but for now, I'll use that experience to help in other ways.
Absolutely. I wish you well, Dr. Yaser Teebi.
Thank you very much. Thank you very
for
much
your time. So that brings us to an end of this episode with Dr. Yaser Teebi, who is a clinical psychologist working in the field of geriatrics. Till next time, thank you for your time.